recent years, the acronym PTSD, or post-traumatic stress disorder, has become something we hear about frequently in the news. For many soldiers, their memories can torment them, and they are changed from the men and women that started out in basic training. John Whelan knows all about this. He worked in the military, then pursued a career in psychology, eventually earning his PhD. For 20 years now, he's worked with serving and retired members of the Canadian Armed Forces. He developed addiction treatment programs and now operates a private clinic in Nova Scotia for treatment of PTSD. John Whelan is hoping to help others through a new book called Going Crazy in the Green Machine. He was on the island recently for a book signing, and we had a chat. Hello, John. Welcome to PEI and to Mainstreet.
Great. Thank you, Karen. Great to be here.
I want to talk about your credentials and then your book, because it seems like you have perfect credentials for a book like this. You were in the Navy?
Yes, I was, yeah.
What did you do there?
I spent 8.5 years in the Navy. I was what's termed a electronic warfare, which meant in the Cold War years, monitoring Soviet movements, missiles, submarines, and from there translated that, I ended up being a technician in the military.
And then you got into psychology somehow?
Yes, I did.
Yeah.
Well, actually, when I left the military at the end of '85, I ended up working in a halfway house as part of my undergraduate degree. And from there, I ended up being director of that facility within a year and a half. So I had to make a decision between either law or psychology. So it served well to take this course because even there, I saw people I'd served with who had developed alcohol problems after they left the military, had, lost things. So that's when it first started, me working with people I'd served with.
When did you first come to know about PTSD?
Most of my work has been in the addictions world. I ran the addictions wing for the Canadian military from the late 90s up until 2005. So in that population, alcohol, drug problems, we were also seeing people with having serious mental health problems and PTSD. Seeing that both were occurring together, even though we tended to treat them separately, that was my first exposure, really. Any addiction work ultimately led to trauma work, either military trauma or things that happened outside the military.
Now, your book is called Going Crazy in the Green Machine. What does that mean?
Well, when I listen to veterans, and I have, thousands at this point over the years, how they describe coming forward with mental health injuries in the military at their experience level is just like, I'm broken, I can't fit, there's just something wrong with him. So they don't see it from a diagnosis point of view, they see it from an experience point of view among their peers. That was one aspect. The green machine, of course, that's just a term that's used when people talk about the administrative part of something like the military. Large organization, very bureaucratic, as many large organizations. And I wanted a title that was captured their experience as more of an edge to what their experience is going through developing mental health injuries and then coming forward to try to find help both inside the military and out.
And your character in the book is a composite.
Yes.
Of patients, people you've stories.
A composite of soldiers. Now, I have one or two that are template soldiers that have served in places like Somalia, Rwanda, Bosnia, Afghanistan. But I wanted to change enough detail so no person could be identified, because that would not be fair to them, and certainly in terms of my profession, it's not something you do. But I wanted to close enough so that it mirrors the experiences of any soldier who's really been around the system for a long time.
Tell me about that a little bit, because I know there is more and more recognition of PTSD. We hear it more in the news. People are getting diagnosed. But it's such a struggle to get diagnosed if you're just a general person in Canada with mental health issues, let alone PTSD. What's it like within the military?
So within the military, I have friends who work on the health promotion end of things. So the military has done a lot in the last few years really to destigmatize, to make awareness of mental health and resiliency within the Canadian Forces. I mean, that's ongoing. In terms of people coming forward, what it's really up against, and that's what I really try to address in the book, is it's really up against training that says do not admit to problems. It's up in indoctrination and an identity that says you're reliable, you're tough, right? So really, at their level, you can have education out there that says it's okay to come forward, but what about my identity? What about my sense of failure as a soldier? What about the shame I carry that I can't be like my peers? I can't keep doing the job. That's a much deeper level that people really have to struggle with. And of course, there's a reality that if you come forward, I've seen some statistics lately that if you come forward for help even now, the chances are down the road, you'll be released medically. So people know that.
In the case of Master Corporal Billy Reardon, that's your character, right?
Yes.
Does he have a lot of struggles trying to get help?
Yes, he does. Billy's trying to really understand what's happening to him as he starts to unravel. He can't do the job anymore. He knows that at some level, but keeps pushing forward as he's been trained to do. So when the event that finally pushes him forward, that he has to see mental health professionals, in his mind, he's trying to do what's expected. But it doesn't work in terms of what's expected of mental health folks, which really, like me, say, well, you need to lower your defenses, you need to give over some control to me to help you. Well, that's a real struggle for a person that's basically been told from day one, you have to be in control. So the real tension of trying to comply with mental health, it's not working, it works for a while. He's trying to understand the bureaucracy of what's happening around him. He's removed from his unit. That's the main struggle for him. So that's within the military. Then going forward now for medical release, and then almost having to start from square one on the outside. Okay, now I've got to apply for a pensionable condition through Veterans Affairs. I've got to try to find a health provider. How do these things work? And they don't work, of course.
Yes, I think we've all heard about that paperwork, and now that offices have been reduced, it is difficult for veterans to always get good help. I see that you offer group therapy. Do people get to the point where they can talk in a group?
Absolutely. Actually, I'm conducting have a group ongoing right now of 7 military RCMP veterans, and we'll be starting another one again in April. So yes, they do quite well. It's not to replace individual therapies. Individual therapies can be quite helpful, but they only go so far. My concern has been that when people go through, see a psychiatrist, see a psychologist, see a therapist, they do it privately, secretly, but nobody knows outside. Their family still doesn't know. They're still not connected with their community. They're not connected with any friends. You know, I've always had a concern and actually presented in Ottawa on this topic that if that's what we're going to offer people, you're well and you're isolated, we have to do better than that. So I've been testing, trialing, producing research around group therapy formats to help people reconnect with other people, to be able to be in an environment where other soldiers will back them up as they go through tough parts of their experiences and they can get well. It's really about helping them reconnect again and not be isolated, you know, living in a sense of failure and shame. That's just terrible.
Is anything changing within the culture of the military to help people realize that they aren't in control, so that they recognize that mental wellness is important?
That's a great question. And I have military friends and I have family members who are serving who would kind of whisper in my ear. You have parallels. So you have education that says come forward for if you're having mental health issues, this is how you take care of your sense of resilience and connection. So that's one stream. But the core of military training doesn't change. It's still about being indoctrinated into being able to do tough things, being able to kill if required. That continues, that type of training.
It's a pleasure meeting you, and thank you for all you do.
Thank you very much for having me.
John Whelan operates a clinic in Nova Scotia for treatment of PTSD. His book is called Going Crazy in the Green Machine. It's published by Friesen Press and is available at The Bookmark in Charlottetown. We have a signed copy of the book. You can call Eva at 902-629-6461 and tell her which area of the forces John worked in. 629-6461.